I'm Won Seog Kim from Korea. In this meeting, I will present the data from ELM-2 trial. The ELM-2 trial is a prospective phase 2 trial of multi-cohort, multi-center prospect trials with odronextamab as monotherapy in relapsed refractory B-cell non-Hodgkin's lymphomas. In DLBCL, relapsed refractory DLBCL cohort, we enrolled 140 cases. Among them, the overall response rate was 49% with 30% of complete response. And the response also quite consistent in cases of in patient with prior CAR T-cell therapies. Therefore, as a whole, the odronextamab is a quite efficient drug in relapsed refractory DLBCL patient. And also, the toxicity was quite manageable. We had less than 5% of cytokine release syndrome. And during the trial, we modified the step-up dose levels for 3 weeks. With that kind of modification, the CRS or other neurotoxicities or other immune toxicities was decreased significantly. As a whole, we confirmed with this trial the efficacy and the manageable toxicity. Therefore, the phase 3 trial in the earlier line of DLBCL will be initiated in the near future.